Hi guys, so I'm going to film my labor and delivery story today. I am a type 1 diabetic, for those of you who haven't been following me up until this point, and I recently gave birth to my first baby, a little girl, and this is going to be the story of my labor and delivery, and I just want to go ahead and throw it out there that these videos can get super long, and I really don't want this video to get super long, so I'm going to keep it to the basics, like the bare essentials. And if any of you guys have questions about my labor and delivery and how it went, leave those in the comments, and if I get enough of them, I thought I would just do a labor and delivery Q&A, so I could do a second video if I didn't cover enough details in this video. So okay, to get started, I gave birth Friday, October 21st, at 12:51 a.m. to a beautiful and healthy baby girl named Sophie, and she weighed 7 pounds, 3 ounces, and was 20 inches long. And here's how I got to that point. So, as a type 1 diabetic, the general practice is to induce, and that usually happens anywhere after 37 weeks. Now, my blood sugars have been in very tight control. I've had excellent A1Cs throughout my whole pregnancy, so my OB was okay letting me go till my due date, which was October 20th. So what I did was I went in on the 19th, the day before my due date, in the evening to get Cervidil placed next to my cervix. And what that does is ripens your cervix so that it's more likely that an induction will be successful. So I went in Wednesday night, they placed the Cervidil. I had sort of a restless night at the hospital. Didn't really feel much from the Cervidil until about 3 in the morning. I got pretty crampy, but just, you know, like period cramps, not anything crazy. And yeah, I didn't sleep too well. On and off, I got a little bit of sleep. So about 8 o'clock in the morning, my doctor, who was on call that day, came in and checked me, and she said that I hadn't dilated at all, so she wasn't able to break my bag of waters. So what she had the nurse do was start me on Pitocin. She started me on 1 unit of Pitocin and told the nurse to increase it every half hour. So that started around 9 o'clock in the morning. They started me on Pitocin, and frankly, it took quite a while before I started feeling anything. You know, in the beginning I thought, is this actually working? But, you know, soon enough I started feeling increasingly more uncomfortable, cramps, and she was upping the Pitocin every half hour. And my intention going into my labor was to try to go naturally and to deal with labor pain with natural pain management. However, one of the things that I'm grateful that I did when I wrote my birth plan was I didn't write a plan, I wrote birth preferences. And birth preferences allowed me to have an idea of what I wanted, you know, given the best case scenario. However, it also left me incredibly flexible during my labor and delivery, which turned out to be necessary because things did not go as planned. So I got to about, I don't remember exactly, I know that I maxed out on Pitocin at 8 units. They say that people require different amounts of Pitocin. Some people go all the way up to 20 or 30, and then other people, their labor gets jump-started much sooner than that. So I got maxed out at about an 8, and around noon or 1 o'clock, the contractions became very intense very quickly. So it went from feeling like, this isn't working, I'm not even in labor, this isn't gonna work, to all of a sudden, boom, like a train hit me. And the pain was pretty unbearable. So my contractions were coming strong, they were coming fast, so I didn't really have a ton of rest time in between my contractions. And the worst part about it is, as a diabetic, my blood sugars were running low, like, the whole time. And my husband kept checking my blood sugar, like, once every half hour or hour, and he would give me glucose. And no matter how much glucose I was taking, my blood sugar stayed right around 60, or even 55. And for any of those of you who have diabetes, you know what happens to you when your blood sugar's low. You can't function. So here I am having terrible contractions, and on top of that my blood sugar's low and I can't get it to go up, and you're not allowed to eat when you're in labor, so I was taking glucose, but I wasn't allowed to eat anything. And yeah, my husband and my mother were both there helping me through each contraction. Like I said, he was giving me glucose. It wasn't working. And it got to a point where I was unable to cope with the labor anymore. I wonder how it would have been different if my blood sugar wasn't low. But yeah, it doesn't really matter at this point. But it got to a point where I knew, like, so in between contractions, and I was thinking rationally, or as rationally as possible, I knew that my labor wasn't going to progress well as it was, because I was so tense during my contractions. I was unable to relax. I was writhing in pain, like sort of crying, yelling. I mean, it was too impossible for me to relax through my contractions, and I felt completely out of control of the contractions and of the pain. So I asked for the epidural, and as you know, like, my husband and I had this system where, you know, I was going to ask several times, and anyway, it got to the point where he knew that it was the right thing. I knew it was the right thing. My doctor agreed that my labor would progress more smoothly and quickly if I was relaxed, and if I had the pain management. And at that point yeah, anyway, luckily the anesthesiologist did not have a long line of patients in front of me, so he was able to get in there pretty quickly, and the epidural was actually super quick, not painful at all. The most painful part about the epidural was having a couple contractions while he was like prepping, and you're like bent over like this, sitting on the bed, trying to stay super still. So having a couple contractions through that was probably the most painful part about the epidural. But the epidural itself did not hurt, and I felt relief almost immediately, and it must have been a really good one, because within a couple minutes I could not feel any of my contractions. I had to even ask, am I in labor? Am I having contractions? And yeah, I do not regret getting the epidural. In fact, I am happy that I got the epidural, because the way it was going, I was thinking to myself, why? What's the point? Like, it passed from feeling pain to suffering. And all along I was saying, I can handle pain. I can do pain, especially pain for a purpose. But this pain, the contractions from Pitocin, it passed that border of pain versus suffering. And at that point is when I said, forget it. I want to enjoy my labor if possible. I want to be present. I want to be able to think back on this time fondly. And I was able to do that thanks to the epidural. So I'm really glad that I got it. After that happened, they upped my Pitocin to 10, and my labor progressed super quickly. Within 6 hours, I'd say. The doctor checked me and I was at a 9. And so she said, I'll come back in a couple hours and see where you're at. And like an hour goes by, and then I felt pressure. I felt like there was like a bowling ball in between my legs. And I told the nurses, I was like, guys, I feel like there's something in between my legs. And the nurse said, well, do you feel it in your bottom? Like, do you feel like you have to have a bowel movement? I said, no, it just feels like there's something in between my legs. She's like, okay, well, you know, we'll wait. Anyway, the doctor comes back and checks me again, and she laughs because she said, oh, the head is right there. So she couldn't even feel, you know, I obviously had gotten to a 10 because the baby's head was at a +3 station. So she's like, you're ready to start pushing. And this was about 10 o'clock at night that she told me that I was ready to start pushing. Right before the doctor came in, and I wonder if this is related to the fact that my body knew that I was about to give birth, I got super nauseous and vomited like the biggest like projectile vomit ever. I had, my mom was holding one of those like vomit catching bags, but it was like, you know, filling up the bag, and I just like lost everything in my system. And then I got the shakes, like I was trembling. I don't know if it's from anxiety or adrenaline about knowing that I was going to give birth soon or what, but yeah, so I vomited, and then I got the shakes really bad, and then, you know, 10-15 minutes later I started pushing. And I wondered if those two things were because my body knew that I was about to give birth. So the pushing part, now this is where things got a little bit unpredictable. I started pushing around 10:20 p.m. and we all thought that she was going to be born on 10:20 on my due date. And So the way the pushing started, the doctor wasn't in the room. It was my husband was holding one leg and the nurse was holding the other, and they had a mirror placed so that I could watch also. And the pushing started fine, you know. At first you couldn't see the head, but you could tell that there was something there, like, so I was watching in the mirror the whole time. And then after several, you know, pushes and maybe, I don't know, 40 minutes, then we started to see the baby's head crowning, like, or not crowning, it was just, you know, a little bit, and then when I'd stop pushing it would go back in. But I will say that the first thing that I saw was a ton of really dark hair, so I knew that she was going to have a full head of hair. Anyway, then it got to the point where when I was pushing, the head would stay in that place, and it wouldn't go back in when I stopped pushing, and that's when the doctor came in, and that's where things got a little bit weird, or a little bit complicated, because the doctor, so my doctor she's an OB, but she's as close to a midwife as you can get as an OB, in terms of, like, her philosophy is very natural. She doesn't like to perform things like episiotomies or C-sections. Like, she does everything in her power to avoid those things. And so one of the things that she did a ton of was the perineal massage, because she is really intent on not letting her patients tear. And so that was basically her job. As the baby's head was coming closer, getting more out there, the doctor was just, like, vigorously massaging my perineum to stretch it out. And she kept saying, I saw her expression getting more and more concerned. She's like, there's this spot that is tight, it is not stretching, there's a ridge in here that the head cannot, I'm unable to stretch it. So the doctor probably was trying to stretch that part of me for about 2 hours or an hour and a half, like a long time. She was, like, you know, starting to get sweaty, even, like, I don't know, I'm exaggerating, but she was, like, really trying to massage me so that the baby's head could fit through. Also keep in mind, this was after a full day of laboring. I was getting pretty tired. It was after 2 hours of pushing. My body was, like, shutting down. It was really hard to push. And, you know, I see on my doctor's face, she's like, she's in disbelief. She says, I can't believe it. I might have to do an episiotomy. And she was like, no, like, she looked crushed that she even was thinking about that. So she continued trying, and then the baby's heart rate increased. And at first the doctor said, okay, we'll keep an eye on it. It's probably just because my fingers are in there and I'm, like, bothering the baby's head, but we'll keep an eye on it. More and more time went on, and the baby's heart rate was high for too long. You know, like, the doctor got to the point where she's like, okay, I'm gonna have to do an episiotomy and use the vacuum. So she got me prepped for that. They give you a shot of lidocaine, I think it is, which is just a general anesthetic. She gave me a quick shot of lidocaine, and then did a small episiotomy, which at that point, the pressure, like, the baby's head had been crowning, like, in that spot for hours, and the epidural had worn off at this point. I was no longer getting the epidural medication, and the feeling of the baby's head being right there, I was like, Jessica, she's like, I'm gonna have to do an episiotomy. I was like, do it, like, get this baby out. And so at that point I was, like, totally fine, because I know she tried everything to avoid it. So she did the episiotomy, and then had to use the vacuum twice. So what they do is, as I'm pushing, the doctor pulls on this little suction. They, like, suction this thing to the baby's head, and the doctor applies this kind of pressure as I'm pushing. And she had to do it twice, like, through 2 of my pushes, and then the baby's head was out, and my husband wanted to catch the baby, which he did, so he was right there. The doctor called him. She's like, come here, it's time. And so the baby's head popped out, and all I remember is the rest of the body seemed to come out in, like, 2 seconds. I mean, the head took hours, and then the rest of the body was just, like, just came right out, and my husband was right there. Both he and the doctor sort of caught the baby together, and then before I know it, so a total of 2.5 hours I was pushing, and then before I know it, I have my baby on my chest, and I'm looking down, and I just, like, wept with happiness. Like, oh, I was saying, oh my gosh, you know, and just that classic sort of, you know, just crying out with relief. Like, the fact that she was out after that long delivery, it just, it was such an amazing moment, and I'll never forget that feeling. Really, it was the moment that I became a mother and my husband became a father. So it was just super intense. And the first thing I thought when I held her was, she's so small, like she's so little. So she weighed 7 pounds 2 ounces, which is a healthy size. That's not super small for a baby, but all the babies on my side of the family, like the small ones are 8.5 pounds. Like I was a 9-pound baby, my brothers were 10-pound babies, and just all my cousins, we all have large babies, and I've never seen a baby, a newborn, that weighs less than 8 pounds. So just holding her, I was thinking to myself, she's so little. And yeah, I kind of waited for some of the commotion to settle down, because since the delivery got a little intense there at the end, the medical staff was sort of, you know, doing their thing. They were checking on the baby. But as soon as things settled down, the first question I asked the nurse was, is it a girl? Because nobody said, it's a girl. And I just, you know, like they tell you on the ultrasound, but nobody verified it when she was born. So I asked, is it a girl? And the nurse told me, yeah, it's a girl. So, let's see, the Apgar scores, she got a 7 and a 9 on the Apgar scores, which those are great, and she pinked up really quickly. Although she didn't have a huge cry when she came out, she pinked up really fast, and she kind of did like a cute little squeak kind of cry like that. It was really adorable, and I was able to do skin to skin with her for, I don't know, it's probably like an hour, or I don't know, before a nurse asked me, can we take her to weigh her and do all that stuff. And actually the first time she asked me, I said, no, I want to hold her longer. But then after I felt like I'd had enough skin to skin time, I let them go weigh her and do all of those procedures. My parents were not in the room watching, but they were right at the door, like behind the curtain. And so they were listening the whole time that I was pushing. I didn't want them watching, but they were listening. And so when the baby was taken over to be weighed, you know, the nurse held up the baby for my parents to see. My mom said, what's her name? And I looked at my husband and I said, all right, is this going to be the name? Like the name we had thought of, is this going to be her name? And he said, yes. And so I said her name is Sophie. And yeah, it was an amazing moment. And let's see, they brought her back to me and I did more skin to skin. The doctor showed me my placenta, which was pretty rad. And I had a birth photographer there capturing all of it, so I got some really amazing shots of my labor and delivery, and probably some pretty gruesome ones too. I haven't seen all of the photos yet. But anyway, after about 2 hours of like total skin to skin time, it was time for me to get up and like sort of clean off in the bathroom. And so when I got up and a nurse helped me and sort of, you know, helped me get cleaned up, I gave the baby to my husband so that he could do skin to skin with her. And I'll never forget that moment, because when I came out of the bathroom, and I had been in there for a while, it takes, you know, time to do that stuff, I walk out and I see him lying there with our daughter on his chest, and just the look in his eye, it was obvious to me that he had fallen in love with her. And you know, he said something like, she's so little, like we need to protect her. And I remember asking him if he thought that she looked like every other newborn, because my husband's one of those who thinks like babies all look sort of similar. And so I asked him, I was like, do you think she looks like every other newborn? He said, no, she's the most beautiful baby I've ever seen. So I mean, it was just really sweet to see that bonding. So anyway, I think that's it. I know I said I was going to keep it quick, and it is so hard to like talk about your entire labor and delivery. I was trying to keep it under 15, but anyway, this will do. And if you have further questions, please leave them in the comments, and I will do a Q&A, and that's how I'll handle, you know, like the length of these videos not getting too crazy long. So yeah, if I get enough questions, I will do a follow-up labor and delivery Q&A video. But until then, that is my story, and I am so grateful that my little Sophie is here, and I just love her so much. And yeah, I'm recovering. I know episiotomies can take a long time to recover from, but honestly, I wouldn't change anything about my labor and delivery. I thought it was beautiful. The fact that I didn't go in there with any expectations was really good, because I was capable of handling the unpredictable things that happened and accepting them for what they were. I'm incredibly grateful that I didn't have to have a C-section. So yeah, in terms of my attitude, like I'm feeling really positive and really good, and just grateful that my baby's here and she's so healthy, and my diabetes didn't hurt her when I was pregnant. So there's a lot to be grateful for. Alright guys, that is it, and thank you so much for watching if you made it this far, and I will see you in my next video. Bye!